This is a consent form for the procedure. It's called a laparoscopic appendectomy. And laparoscopic means you work through small incisions with long instruments on a television screen to perform the procedure minimally invasively. Usually it consists of 3 small incisions, one at your belly button, one actually on the left side of your abdomen, and one kind of over the pubic bone. And then because the appendix lies on your right side, we work towards the appendix. The abdomen's blown up with air on the inside, and we take the appendix out with those long instruments sticking out to the back. So one of them is about the size of my thumb, the other 2 about the size of my finger, so pretty small. There's about a 95% chance that we'll be able to do that successfully for you using the small incisions. But there's always a chance that if for some reason we can't visualize the appendix well, the anatomy is difficult, we convert to a standard incision for your safety. It usually goes right over the side of the appendix and is about this long. Okay? That usually doesn't change the amount of time that you're in the hospital, though. So usually about a day for non-perforated appendicitis. The risk of the procedure. So any surgery has a risk of bleeding. It's a rare risk. Most people do not need any kind of blood transfusion with this procedure, and certainly not so much bleeding where you need to go back to the operating room. So a very small chance of that. The other risk is infection. So a little bit higher risk of having an infection with an appendicitis because the appendix is infected. So the infection can be either at the site of the skin or an intra-abdominal infection called an abscess. Usually the risk of having an abscess is higher if the appendix is perforated. So it's a pretty low risk, just a couple of percent if the appendix hasn't perforated to have an intra-abdominal abscess. That generally is treated with 1, IV antibiotics, and 2, usually with a drainage procedure through radiology and not another surgery. Okay? We have to make sure that we don't injure any other organs when we're in there, so no injuries to the bowel, very rare. And also the appendix is taken off of the colon with a stapler, and so that staple line has to be watertight. The risk of having a leak from that staple line is less than 1%, but that would require another surgery. So all these things are very rare, but it is a surgery and you need to know what the risks are before we proceed.
Yep, thank you.
Okay. Do you have any questions about the procedure, post-operative care?
Well, we were wondering about after surgery, because we are in a hotel. Our hotel's out by Midway. Our friend's hotel is downtown, and I'm just wondering what he's going to be able to do.
So you should be able to do normal daily activities. You can walk stairs. You're going to be tired. It's going to feel like you've had a bad flu. You're going to have a little bit of incisional pain. But you should be safe to be at someone's home by the time we discharge you.
About how many days do you think that would be?
So like I said, I think there's the potential that you could fly back home within like 2 to 3 days. But I would advise you to just kind of take it, get through the surgery, see how you feel afterwards, then see how you feel on Sunday, and then make an assessment about the flight for the next day. So you will be able to walk around, go to the bathroom.
No dancing.
If you really like to dance.
Okay.
No break
You
dancing.
need to. Can we just get like the doctor? We need a note for the.
Oh yeah, we'll take good care of all that.
Okay.
Okay?
Okay.
Okay. All right. I'm going to have you
Sounds
sign
good.
your consent form.
Yep. Thank you.
You're done.